more than 45 years, Morehouse School of Medicine has been an anchor in underserved and vulnerable communities, training clinicians who provide quality, culturally humble care. We've been on the forefront of innovative and transformational research that delivers on the promise of science and medicine. And we have been preparing the future health leaders the nation and the world needs. Morehouse School of Medicine has always had a unique view on health disparities, which has kept us ahead of the curve. In March of 2020, what really came to pass was this unveiling of health injustices and inequities. But holding true to our mission at Morehouse School of Medicine, we were ready because we had laid the foundation and implemented solutions in understanding the root causes of health inequity. Our forward thinking in the areas of education, research, and patient care has really shown the world in 2020 that we were leading in providing the community what we do best. Over the past year, Morehouse School of Medicine continued its bold vision to advance health equity and facilitate transformation in the lives and the populations we serve. Our mission of improving the health and well-being of individuals and communities, increasing the diversity of the health professional and scientific workforce, and addressing primary health care through programs in education, research, and service is what drives us. It is what brings us even closer to realizing a world where no person is unduly burdened by disease and sickness. As we transition into year 2 of the pandemic, Morehouse School of Medicine transformed and expanded our educational programs to meet the growing needs of the future. We increased our online education and extended programs, resulting in being ranked as the #1 online biotechnology program in the U.S. Morehouse School of Medicine experienced its largest increase in new students this past year, with 224 entering students across 12 degree programs. A total of 110 students matriculated in the entering 2021 MD class, and it was the largest entering MD class to date. Note that I said to date. Our decision to bring the PA program to Morehouse School of Medicine was really shown to be a success in 2021. And the program earned a favorable vote from the ARC-PA Commission. This approval allows the program to move into the final stage of accreditation to achieve accreditation continued status. The MSM-PA class of 2021 earned the National AAPA Award of the Most Outstanding Student Society and graduated its inaugural class of 19 student learners in June. We also noted that we increased our class size to 30. Because of the commitment our students have to the PA program, there is no surprise when I hear of individual awards for health policy and increased service to the West End. We also had a highly successful match day with 99% of our MD students matching. Of those who matched, 95% of them got their first choice, and 82% matched to primary care and core specialty programs. Again, living out our mission. Additionally, we are proud of those who excelled in our public health and graduate education biomedical science programs, who stayed focused on research and displayed their leadership through scholarly publications, impactful community engagement, and outreach. We celebrated many accolades ranging from notable students and faculty who were honored for their care delivery to gaining grants that supported valuable learning experiences toward advancing health equity. Our success continued to surge through the pandemic as we officially launched the More in Common Alliance. One of the greatest impacts of this, the More in Common Alliance, is the transformation of career opportunities for Morehouse School of Medicine students within the Common Spirit network of medical facilities. We've announced the launch of 5 regional medical campuses as part of the Morehouse School of Medicine and Common Spirit partnership. This will enable 3rd and 4th year medical students and 2nd year PA students to complete their respective degrees while working in settings that reflect Morehouse School of Medicine and Common Spirit's health commitment to educating students from underserved and rural communities. We proudly declared the initial undergraduate training sites at Common Spirit Health Hospitals in Chattanooga, Tennessee, Lexington, Kentucky, and Seattle, Washington. In addition, we are also extremely excited about our postgraduate residency training opportunities in California. Those cities that we selected are where we believe that we will have the greatest impact: Bakersfield, Los Angeles, Santa Cruz, and Ventura County. At Morehouse School of Medicine, we believe that instilling cultural humility in our future physicians, our future physician assistant students, and our public health students is a key part of closing the health equity gap. While the pandemic tested all of our ability to traditionally deliver care, Morehouse School of Medicine realized that patients really do want varying levels of access, and they want to know that they have unique ways to interact with their healthcare providers. So in 2021, we increased our telehealth efforts, and were able to do so because we received a $1 million grant from USDA to develop the Georgia Digital Framework of Health Equity. This grant helps us improve the journeys of our patients. KPMG supported Morehouse School of Medicine in the development of our new COVID-19 network to inform community-driven responses, recovery, and resiliency strategies for how we saw this COVID-19 pandemic impacting our communities. The platform that was developed allowed communities, those communities that we serve, to be paired with and cared for where and when they needed to be cared for. Morehouse School of Medicine continued to innovate all through 2021, and we have not stopped yet. We have done a survey where African Americans are not demographically represented and developed bridges to biotechnology and bioentrepreneurship intersecting biology and technology to address global challenges in climate, aging, health equity, food production, and infectious diseases. While it is our belief that telemedicine will continue to shape the future of primary health care, improve access, increase quality, and reduce inefficiencies, we know that we have to have leaders who are able to help narrow this digital divide. At Morehouse School of Medicine, research is fundamental and foundational to our ability to translate discoveries into health equity. Underway at our research centers and institutes is not only translational but also transformational research that innovates against poor health outcomes, disease burdens, and health disparities. One example is our newly formed Center for Maternal Health Equity, which was selected by Goldman Sachs as a 2021 recipient of the 1 Million Black Women Investment Initiative. This selection has enabled our Center for Maternal Health Equity to reduce factors that contribute to high rates of poor health outcomes and maternal mortality for underrepresented women. These women are more likely to experience barriers in obtaining quality, culturally humble care. Our research has also garnered the interest of those who believe in reimagining who should be able to participate in discoveries and delivering the promise of science to our communities. Because of new partnerships, we have become a leader in increasing the participation of minorities in clinical trials. We've been able to use our partnerships also to magnify the focus of why we need children, African American children and families, to participate in those clinical trials. We've also been able to increase our ability to partner with pharma to ensure that our communities are not left out of opportunities for participating in clinical trials that are evaluating new therapeutics or new technology that will improve health outcomes. Partnerships with companies like Gilead Science, Google, the Annie E. Casey Foundation, and the CDC Foundation has helped us to integrate technology through all of our learnings. We recently launched a health equity tracker, which enhances outcomes of health issues in underserved communities and provides crucial data concentrated on health equity at the county, state, and national levels. The data unveiled by the Health Equity Tracker allows the world to see the substantial differences in health outcomes and those that exist for vulnerable population. The Health Equity Tracker allows for further prevention of health disparities and pushes for change in policy for better health care access by using data that is at the county level and at a state level. While we're very excited about the advances that we have made across all of our mission areas in research, clinical, and education, we also understand that we needed to advance our administrative structure and bring on new leaders to help to continue the advancement of health equity. So we're very excited about the addition of our new Dean and Executive Vice President of Health Affairs, Dr. Joseph Tyndall. With a degree from the University of Maryland School of Medicine, Dr. Tyndall is the former chair of the Department of Emergency Medicine at the University of Florida College of Medicine. While he is charged with overseeing our programs in education and clinical care that are an integral part of our current strategic plan, he is well prepared to lead a new strategy that will advance our ability to increase access of care for people in the state of Georgia and beyond. He will also be an integral part of how we advance who we educate and train through our Common Spirit partnerships.
Over the last year, as we received national recognition for our social mission, we created new partnerships with world-class organizations, including Common Spirit Health and Bloomberg Philanthropies, which have fortified our position to achieve long-standing strategic goals. Our significant transformative partnerships include planned expansion of ambulatory service lines. Morehouse Healthcare is creating exciting networks to offer greater subspecialty services to communities in and around Atlanta. Our partnership with Microsoft Global Healthcare has proven its ability to create a fully integrated platform process for virtual health. The collaboration develops integration tools that will allow multidisciplinary focuses of engagement in real time through telehealth. At the completion of the Clinical Innovation Partnership, MSM, through our telehealth data and outcomes, will provide educational advantages and analytics that support advocacy efforts in policy and legislation that impact healthcare, real-time indicators that alert physicians to matching patients with appropriate new and ongoing clinical trials and research. Physicians in their ability to easily access efforts and information that align with patient needs, particularly in rural and remote locations.
Our student success model could not thrive without financial support. This past year, Morehouse School of Medicine has raised more than $137 million in private grants and over $4 million in private donations. And while a significant part of our donations have come from Common Spirit Health, there have been many other partners who have made a difference. Nevada's U.S. Foundation, Microsoft, Goldman Sachs, and Bloomberg Philanthropies have helped Morehouse School of Medicine close the gap in health equity.
My name is Cassandra Riley. I'm a part of the physician assistant class of 2023. I decided to go with Morehouse School of Medicine because their mission statement describes how they want to provide equity in the underserved and close that gap in disparities. So this funding, which I'm very grateful for, has given me the opportunity to help pay for some of my schooling. So this has helped to increase our resources here at school with different programs that we use to study. We really appreciate this, and we love to see that you care about us and you care about our futures and you care about what we are working for.
Through your individual gifts, you have also made a difference in who we educate and train, how we educate and train this next generation, the discoveries that we pursue that will deliver that promise of science to the community, and how we build that bridge between healthcare and health. So to you, I say thank you. And I know that you share in the gratitude that we have for the many ways in which our institution continues to prepare future healthcare learners and leaders. So I know that you will share with me in gratitude for the many ways in which our faculty, our staff, our community partners, and of course our students continue to prepare this institution to do the work that we are required to do to lead the creation and advancement of health equity. Not just here in Georgia, not just in the southeastern region, not just in the United States, but around the globe. Moving forward, we are stronger than ever before, but the work remains unfinished. Our transformative mission will develop the institution into a full-fledged health sciences university by the end of the decade. With 2022 well underway, we remain focused on our mission, our vision, and our values, embracing the truth of our capital campaign. The world needs what we do best, and we are the ones we have been waiting for. We are the ones filling the need. Thank you. Learn more how you can help with MSM Mission by visiting www.msm.edu/impact.